Justin Bieber.
Selena Gomez.
Kanye West.
What do they all have in common?
Let's find out.
They all live with chronic conditions. So let's talk a bit more about that. So a chronic condition is a disease that may last months or even years, and as such may require a longer period of time to treat. In this video, we're going to sort of dispel some myths surrounding these conditions, as well as explain a bit more about them so that you all know better.
Okay, so let's talk about Kanye West. As most of you may know, he suffers from bipolar disorder. Okay, so what is bipolar? Most people think it's just fluctuating moods, day by day, hours even. However, that's incorrect. In fact, it can last from days to even months.
So, bipolar disorder is characterized by something that we call mania. Now, mania consists of extended periods whereby an individual may experience things like elevated mood, impulsivity, and even something like irritability. Now, also, some people may experience bouts of depression, as well as some normal periods in between these phases. However, not all people with bipolar disorder experience depression, although mania is characteristic of bipolar, and so all people with bipolar experience mania.
When it comes to the treatment of bipolar disorder, we sort of treat it as we go along. So someone who to experience, let's say, an episode of mania, we treat that mania with an antipsychotic drug. If someone were to experience depression, we treat that depression with antidepressants. But the mainstay of treatment is that throughout, we give them what we call mood stabilizers, so stuff like lithium, sodium valproate, you may have heard of them. But that is just so maybe we can prevent these fluctuations from happening in the first place. However, that's not all. We can also offer things like therapy, which may sort of help people talk through their feelings and experiences, and it could be used to aid their emotions during these episodes of depression or mania. I just have to preface what I'm about to say with the fact that we're not saying that Kanye West's actions are due to his bipolar, but when you look at things he's done in the past, such as interrupting Taylor at the VMAs, and also his very public and heated exchanges with Pete Davidson and Kim Kardashian, you can kind of see that there is a degree of impulsivity and irritability by what he's been doing.
Okay, so let's move on to Selena Gomez. And unlike the show House, it is lupus.
You stash your drugs in a lupus textbook. It's never lupus.
So, what is lupus? It's an autoimmune condition, and although some people may consider the body a temple, in fact, sometimes your immune system can attack your own cells, and it can cause symptoms such as rashes, hair loss, dry mouth, and other more serious conditions. In fact, in Selena Gomez's case, she had a complication of lupus. It's called lupus nephritis. She had symptoms such as high blood pressure, swelling in her joints, joint pain, and it all subsequently led to her getting a kidney transplant.
So when it comes to the treatment of lupus, as an autoimmune disease, things can be quite tricky. And when it comes to drug therapies, there's sort of like a multi-level approach that people can take. So starting off at the most basic level things, people can take over-the-counter drugs such as ibuprofen, and they might find that this helps with their rashes and a little bit of symptomatic relief. Now, stepping it up a bit, people can take steroids. Now, I don't know if you remember earlier this year, Selena Gomez came under quite a bit of flack for her recent weight gain, wrongfully so, because this was sort of out of her control, as the use of steroids to control her lupus caused her to start gaining weight, as that is a side effect. And then, at the most extreme form of treatment for lupus, we have drugs that we call immunosuppressants. So drugs that sort of stop the body from attacking itself. Now these drugs can be pretty nasty sometimes, as their side effects are quite unpleasant. However, they are probably the best standard of treatment that we have for a disease such as lupus, as of course the main issue is the body attacking itself. Next up, let's talk about Justin Bieber and his recent diagnosis of Ramsay-Hunt syndrome. But what is Ramsay-Hunt syndrome? Well, it's caused by the reactivation of the herpes varicella zoster virus in the facial nerve. Now, you may not have heard of the herpes zoster virus, but I can assure you, you've all had it in the form of chickenpox. Now, what happens after you have chickenpox? Well, what the virus does, it finds a nerve in your body and it decides to lay dormant there. But what happens later on in life? Well, that's where the fun begins. What it does is, it reactivates itself and it starts to cause a nasty infection, which is what we call shingles. And now, Every time you get shingles, it's specific to whatever nerve the virus decides to find its home in. In this case, it's found its home in the facial nerve, or otherwise known as cranial nerve 7, and it can lead to a whole host of nasty symptoms. Let's find out more about that.
Right, so what symptoms do patients usually get? It's usually some facial paralysis, maybe a vesicular rash, some ear pain, and perhaps a loss of taste. The thing is, why do we get these symptoms? First of all, let's look at the anatomy. So initially, the nerve enters the inner ear cavity, where it can cause ear pain and some hearing loss. This is due to the close proximity of the nerve to other nerves in the region. Okay, next, the nerve actually exits through the base of the skull, where it enters the parotid gland, and it gives off its 5 divisions. So these divisions actually communicate to the brain, and the brain allows you to control your facial muscles. If that communication is interrupted by the inflammation, this is what causes the facial paralysis. Now, the vesicular rash, this is caused by the varicella zoster virus moving into the skin area. Okay, and finally, the facial nerve, it actually controls the anterior 2/3 of your tongue's tastes. So it may be noticeable or it may not be noticeable if you lose some sensation in terms of taste.
So first of all, apologies for the runny nose. I've somehow managed to get ill throughout the course of filming this video. But let's move on to the management now of Ramsay-Hunt syndrome. So usually the diagnosis of Ramsay-Hunt syndrome is through the clinical history and examination of a given patient. There aren't usually routine investigations that are performed. Now, an important point is that varicella zoster virus tends to reactivate in individuals who are immunosuppressed. Now, there can be several reasons for this. It may be stress that's placed under that individual or another relevant medical condition. In terms of how we manage Ramsay-Hunt syndrome, there's almost a two-pronged approach that we can think about. One of which will be managing the actual symptoms of the disease. And the second part is through targeted drug treatment. Now, how can we manage the symptoms of Ramsay-Hunt syndrome? You can use over-the-counter pain relief such as ibuprofen and paracetamol to help relieve the pain from the shingles type rash, the vesicular rash that occurs on the face. You can also use a warm compress that can also help with the pain. Now, there's evidence that giving prednisolone, which is a steroid, as well as acyclovir, which is an antiviral drug, early on in the condition can help with the prognosis of a patient with Ramsay-Hunt syndrome.
And this concludes our video talking about the chronic conditions of Justin Bieber,
Selena Gomez.
And Kanye West.
This has been GHU Medics.
Thanks for watching. Okay, so I'm testing right now to see if the audio quality is better at all. Because I think if I move away, it doesn't actually make it. Let's find out.